Puzzles and Pieces. This is Jessica from MultiplicityAndMe, a channel dedicated to ending the stigma of DID. Today's topic has been brought to us by our fabulous patrons. Thank you all ever so much. And the topic is how to deal with not knowing who is fronting or when you're feeling kind of blurry. My guess is this question was sent in by another DID system because I can't necessarily imagine someone without DID necessarily understanding or knowing exactly what that means. So let's break it down. Today's topic will be broken down into an overview, personal experience and suggestions, and then a summary. We're probably all used to the stereotype of DID that kind of says all alters need to be completely differentiated and separate and different all of the time, which we've kind of debunked when addressing the DID overt versus covert kind of presentations that you can see in the little link at the top if you need a refresher. But regardless of whether or not the differences between the alters are noticeable on the outside, not knowing who you are or being blurry or mushed together is an extremely common feeling within systems, as the structured clinical interview for dissociative disorders takes note of these primary symptoms in regards to the dissociative diagnosis process. These main symptoms are noted as depersonalisation, derealisation, amnesia, and identity confusion or alteration. For a quick summary, because I think that kind of each of these points need their own video, depersonalisation. Depersonalisation is the sense that you're having an out-of-body experience. You or your body isn't real, or you feel entirely detached. Derealisation is really similar to depersonalisation, only the focus is on your surroundings rather than necessarily yourself, and everything feeling kind of dreamlike or unusual, distant, foggy, unreal. These two can often coincide and can be abbreviated to DPDR for short. The next on the list is amnesia, which is pretty self-explanatory. I'd like to think that many people know what the definition of amnesia is, where there's a failure beyond forgetfulness to recall something. But what people tend to forget are also the micro-amnesias, so forgetting a conversation that you've just had, not realising that you've already been in conversation, not recalling the last thing that was said, all those sorts of things. Finally, and the one that we're going to be focusing on, is the identity confusion and alteration category, which essentially means that you may not know who you are in terms of identification. You may suddenly be confused about your feelings, your thoughts, your gender, your sexuality, what you like, what you dislike. Suddenly, you don't know who you are. As you may be able to imagine, suddenly not being able to recall facts about yourself might be mildly terrifying, if not at the very least a little bit uncomfortable, a little bit frightening. This was much more prominent for us when we understood much less about our condition and what was going on for us. I was constantly living in a world where I was unable to define who I was, what I liked. I didn't know my gender, my sexuality, or even what my name should be. It was really unsettling and caused huge amounts of anxiety. But this identity confusion can also come in smaller doses, such as recognizing that you have like an alien thought or feeling that doesn't belong to you, it belongs to another alter. But that can be put down to something called passive influence. So that's kind of when another alter is influencing you without you necessarily realising. And again, there's another example of a video that we did about this some time ago. But speaking, as we always do, from personal experience, the how to deal with the not knowing part is difficult. Even when you're at a point in your recovery journey where you understand who your alters are and what defines and separates each of you, this doesn't stop parts kind of blurring and mushing together, seemingly sometimes without reason. This doesn't stop parts from kind of mushing and blurring together at seemingly random intervals. At the beginning, before we understood that what was going on for us was DID, we felt that basically we were in a constant state of identity confusion. I think looking back, most of the life that I do remember, we were just confused. It made us erratic, moody, and feel extremely out of place in our environment and what was going on for us at any given time. Just from that personal experience, I would definitely say that pre-diagnosis or early in your understanding DID journey, before you essentially know much or anything about your alters, it's the most confusing and unsettling time in terms of the identity confusion and alteration, because you don't even know that there are people in your head, or you don't know who exists in your head, and therefore how can you kind of help your brain decipher who belongs where, what, and why. Moving on from that, once we were able to define our parts and almost compartmentalize who everyone was and what was all about, which helped us understand more about who we were as a whole, we were able to clearly recognize those times when we were maybe co-conscious or maybe confronting or maybe having passive influence, and certainly then the times that we would just be blurry and have no idea of who was currently taking front. But of course, you know, when you're at a state of blurriness, when you're at a state of confusion of not knowing who is around, who is present, it is extremely anxiety provoking because you've suddenly lost a clear sense of self. You've lost your identity in that moment. Conflicting thoughts of like seemingly equal importance, which has come at the same time, like coming to fruition at the same time, which will kind of render us in a completely dissociative state, because how can you function without clear thought? If it was really bad, we would then have like accompanying DPDR with it. Thanks, brain. Thanks, brain. Much appreciated. And that would make us feel completely detached from our body and the world around us at the same time as not knowing who we were. Sometimes we would just have to like sit out or lie out for minutes, sometimes even hours. And the only thing that we personally found that helped was sleep. I've read on support posts online though about other people asking this question and what helps them, and some people were saying that what helps them is having somebody else like coax out an alter, call an alter out, or you know, entice the alter with something that they like to come forward. That didn't work for us, but again, you know, it may do help others out there. But since we began our specialist therapy, a big thing that has helped is actually learning to sit with it. So disregard the anxieties that all these uncomfortable emotions kind of bring to you. Even if you don't know who you are, you just say, that's okay, I might not know my own thoughts or my own identity right now, but it's not going to hurt me and it will pass. And then you try and get on with something that requires no thought. So maybe going out for a walk, or washing the dishes, or watching TV if you can decide on what to watch. As confusing as it is, you know, that blurriness can't hurt you, and the walls between alters have just come down for whatever reason. Or sometimes I refer to it as like a foot in the door syndrome, like almost like two parts have kind of tried to go through opposite ends of a revolving door at the same time, and now we're all stuck. That's how that kind of blurriness sometimes feels to us. It's like, I don't know who was supposed to make it through the door to be here right now, but somebody's stuck. In terms of how people are perceiving you, I know that the lack of compartmentalization can also make outsiders feel uncomfortable too. As for example, obviously we have very distinct, different voices, which is very unusual for DID. Again, I have to add in there, we are minority, not a majority in terms of our DID presentation. But with very differentiated accents, what happens when we blur is that it tends to automatically default to my voice, no matter which parts are blurry if they start to cross over. So this may cause like my friends, my hubby to identify who's fronting at the moment as Jess, even if I'm not actually present and there are other parts blurring at that moment in time. So if you're with a friend or a partner and you have a moment of being unaware of your identity, we found explaining to them, look, I don't know who I am right now. Please try not to use a name as it kind of adds to the confusion, is a healthy and helpful request. I know sometimes as well that grounding techniques have also helped, but equally if the DPDR setting, grounding is very difficult to do without thought. I can't think of 5 things I can see, 4 things I can, without clear thought and clear ability to do so. So the only thing that helps that kind of DPDR for us at the point where we're kind of blurry as well is using kind of that ice therapy. So sticking our hands in freezing water, putting ice on the back of our neck, jumping into a freezing cold shower. That's what we have found that helps. But again, of course, this is going to be different to everyone because we're all unique. I could genuinely not find anything in black and white, I guess, on combating identity confusion and alteration within any research journals. But if you've happened to find something, please do link it below because I would then love to read it and I can add it to the description of the video for anyone else who may want to do their own research and look into this on a scientific basis rather than just for personal experience. But regardless, I hope that this has been able to help someone out there somewhere. Okay, so a rundown of what we've learned. Identity confusion and alteration is part of the symptomology for a dissociative disorder and is therefore extremely common. No matter how much you've identified your alters, Alters may blur together from time to time, perhaps from a trigger, or maybe there's just no obvious reason. Number 3, this can cause a lot of confusion, anxiety and discomfort, and may coincide with the wonderful depersonalisation and derealisation for that cherry on top. 4, from personal experience, the best way to combat this is if DPDR is already included, is to kind of shock the nervous system by doing like cold therapy and doing something sudden. But again, this may not be right for everyone. Number 5, if it's just the identity confusion present, from what I've seen online, some with DID have found it helpful to call or encourage certain parts to come forward. From personal experience, another way has been to reduce the anxieties of identity confusion by affirming to yourself that it's okay to not know who you are right now and it will pass soon, as well as trying to get on with something mundane rather than kind of let yourself sit with that fuzziness and discomfort of trying to dig around for who you are. As again, for us, I found that made us worse. It would seemingly only make our anxiety worsen or maybe prolong this confusion and this current state. Number 7, remember, don't be afraid to let others around you know how you're feeling and what you're currently experiencing. Don't be afraid to ask a loved one or someone around you to do or not to do certain things to make the situation better. So i.e. for us, it was to not call us by a specific name. And a last big point, of course, is to speak to an actual mental health professional off of YouTube about any impacting symptoms that you may be experiencing, and to remain critically minded and practice self-care when it comes to taking advice from anything online. Well done on becoming more educated, everyone! Yay! Psychoeducation is a really powerful tool and we are extremely proud of you. And of course, remember, regardless of whether or not you have DID, each part of you deserves self-love, self-care and compassion. And remember to do all those normal things. Don't forget to like, comment, share and subscribe, as it really does help the channel grow and helps combat stigma wherever we go. And feel free to follow us on Instagram, Facebook, Twitter and Patreon if you'd like to see a little bit more about what goes on from our day to day. That's it for now, everyone. Bye! So the 2 shout outs we need to do this month are for FuzziesArtDesigns on Etsy and the Dotty Room on Etsy. And you can use the code MULTI10 for 10% off that has been very generously given by both companies exclusively for you guys. And if you guys know of any small to medium businesses that could do with a shout out and who do cater to mental well-being or have any well-being ideas, yeah, feel free. Make sure you email us at multiplicityme@gmail.com and we will try our best to give them a shout out in our videos.